InvestorIdeas.com podcasts. Good morning and welcome to another InvestorIdeas.com podcast, looking at cannabis news, stocks to watch, as well as insights from thought leaders and experts. In today's podcast, I'll be interviewing Chris Bunka, who's the CEO of Lexaria Biosciences Corp, trading on the CSE as LXX and the OTC as LXRP. Thanks for joining me today, Chris. And for our listeners that might not be super familiar with your company, would you be able to start with maybe a little bit about your background and the brief history of your company's creation?
Absolutely. Well, thanks for having me on the show. I'm Chris Bunka. I'm the CEO of Lexaria Biosciences. Lexaria has been around for over a decade as a public company. The first half or so of its life as a oil and gas company with modest success. But we moved into the biotech and cannabis spaces about 4 and 5 years ago. I've been with the company since 2008. I suppose I'm fairly well known as a venture capitalist and former editor and writer in the financial industry. Have really been something of an entrepreneurial character for the last 35 years. So we've got some really good people in Lexaria, including our president, John Doherty, who is the former president of Helix Biopharm, a TSE company, a very well-known company working on some cancer therapeutics. And so we have some really high-profile specialists in each of their particular areas of interest.
Awesome. Can you explain maybe in simple terms how the company's delivery technology, DeHydroTech, works and some of the applications for that technology?
Well, that's a great question. Thank you. And DeHydroTech really is the core of our technology suite. It was back in 2014 that a couple of PhD researchers approached me. They had started the development of that technology and filed for the first 2 original patents pending in the United States back in 2014. We looked at it, I had it vetted by a number of different experts, and we decided to get involved. Through a series of transactions over about a 3-year period, we ended up not just licensing the technology, but eventually acquiring it 100%, and it now is 100% owned by Lexaria. We've dramatically increased the scope of the technology from what was originally envisioned. So today, if my numbers are correct, I believe we have 49 patents pending in 43 countries around the world, and we also have 8 patents granted with regards to the DeHydroTech. And we have vastly expanded the applicability of the technology. It was originally developed to deliver cannabinoids through edible forms and to help make that delivery more efficient. And while it does that very, very well, we have also expanded it and have received patents on the delivery of NSAID, non-steroidal anti-inflammatories. That's stuff like aspirin or ibuprofen, also for fat-soluble vitamins and also for nicotine, all patent granted. We're still patent pending on other molecules, things like hormones, whether they are male or female hormones for the humans, as well as phosphodiesterase inhibitors, PDE5 inhibitors. Those are products like Cialis and Viagra, among others. Our technology really should be thought of like a dinner plate. If you think of a dinner plate in a buffet line, we make a high-tech dinner plate. What you put on that is kind of up to you. It's up to our customers, our corporate customers, to decide which drug, which API, active pharmaceutical ingredient, they want to deliver more effectively. And our plate, if you will, if we continue that analogy, helps them to pile that drug on and get it into your body more effectively. The tech is based on some very well-known biochemistry that each of us has within us, and it's the body's propensity to absorb long-chain fatty acids. That is a type of very thin, highly refined fat or oil, such as, say, sunflower oil or walnut oil, avocado oil. They are all high in oleic acid, which is one of the subcomponents of that oil. And we, pardon the crude analogy, but we sort of crazy glue the long-chain fatty acid to the side of the API. We're very different than nanotech. Nanotech makes things small, and then if they're truly building a nanoparticle, they wrap the small particle in layers of emulsion. We don't do that. We actually make things bigger. We take 2 molecules and we glue them together, so to speak, to form a larger entity. And the process that we use to do that is very beneficial because it allows your body to selectively detect aspects of each molecule. It's a long way of getting to the point that when you use our tech, what happens is you smell and taste the oleic acid, which if you ever try tasting sunflower oil, you know it actually has no flavor. It's classified as a neutral flavor. So we mask the strong, bitter aroma and flavor of cannabinoids. And then once it's in the body, the real magic part of the technology is that oleic acid in a long-chain fatty acid is known to enter across the intestinal wall via a different pathway than just about everything else you eat. Everything else you eat goes across the intestinal wall into the hepatic vein and then into the liver for processing before it's released into the bloodstream. Oleic acid from long-chain fatty acid crosses the intestinal wall and dumps into the lymphatic lacteal system, which dumps into the lymphatic circulatory system. And that is the process by which we avoid first-pass liver metabolism. That has really profound effects for the delivery, not just of cannabinoids, but also of things like nicotine and NSAIDs. NSAIDs in particular, nonsteroidals, are known to cause liver and kidney damage. And so if we are able to more effectively deliver an NSAID directly to the bloodstream without the metabolic processing in the liver, we theorize that we could do that much more effectively with lower doses and maybe reduce the amount of liver and kidney disease. So Dehydratech is a big platform. We're working on any number of different research projects at any given time with regards to it for the delivery of cannabinoids and these other molecules. And the two classes of molecules that are gathering the most attention for us these days are the cannabinoids, of course, as well as nicotine, which is getting more and more attention because of a study we did earlier in the year. So hopefully that kind of gives an idea of how it works.
Yeah, that's really impressive that it can do that, as well as, I just want to make sure that I'm sort of hearing you right. So you're also able to get rid of the actual bitter taste as well of the cannabinoid.
Yeah, it's really astonishing, and I've experienced it 100 times because I've tried many of our products, and with full spectrum hemp oil, and it's incredible how profound an effect it has. In fact, in the old days, 2-3 years ago, I remember being at trade shows, and I remember some people looking at me after they tried a sample of a product with hemp oil and saying, well, you're a liar. There's nothing in here. I can't taste it. And I said, well, that is the point, that you shouldn't have to taste something that tastes, unpleasant to most people. There are some cannabis aficionados who really like the flavor of cannabis, but most people really do not. It's very strong. It's very bitter. And guess what? Consumer products need to perform better. They need to not be nasty. Dehydratech does not use any chemicals, and we don't use any sugar. So you do not need to add a lot of sugar. You don't need to add any sugar. And you don't need to add any chemicals to the food product, to the edible product. And that's a huge plus nowadays when people are reading food labels all the time.
Just sort of going back, I guess, a little bit to the Dehydratech technology, would you be able to discuss some of the lab results and research you found so far, and maybe sort of what's next for the testing protocol of that drug delivery platform?
Absolutely. This is actually one of the areas where I think Lexaria shines in comparison to the vast majority of companies out there, certainly in the cannabis space. We're a small company, but we punch above our weight, to use an old boxing analogy. And we are perhaps the only company our size in North America that has completed all of in vitro, in vivo, and human clinical studies. So a study that we just released was on a human clinical study that was conducted in Europe using our Turbo CBD hemp oil product. And in that study, no surprise to us internally, but in that study we demonstrated that we are able to deliver much, much more cannabidiol into the bloodstream in a human being with our technology than without, and much, much more quickly. And one of the results from that study was that we actually compared the data of our study to a previous study that was done a couple of years ago by Mount Sinai. And in that study, they had tested for cannabidiol absorption in human beings with cannabidiol supplied by GW Pharmaceuticals, a fairly well-known company in the space. As a matter of fact, the 30-minute mark, so 30 minutes after dosing, our turbo CBD on a pro rata basis, so having the sample sizes or the dose sizes arithmetically adjusted to be the same, because they use 400 milligrams, we only use 90. But if you make that adjustment, we actually had over 900% more cannabidiol in blood in 30 minutes than they did. We're super, super proud, but it's one study. We've done a lot of studies. We've done in vitro work back in summer of 2015. Back in that study, we evidenced between a 300 and a 500% increase in getting cannabidiol across the intestinal cell lines. We've done studies in rats. We've done human skin studies, penetration studies. We did a rat study earlier this year, same technology, different molecule. That study was for delivery of nicotine. And in that study, very similar type results. We, with our tech, were able to deliver as much nicotine into the rat blood in 15 minutes with our tech as required 2.9 hours without our tech. And in that same study, after the test was complete, we took liver, kidney, and brain tissue samples, and we evidenced 560% more nicotine in brain tissue with our tech than without. All of these things pointing in the direction that our technology is very, very efficient, so you can use a smaller dose, and it's very, very quick. So one of the big criticisms of cannabis edibles is they take so darn long to work, and that, by the way, is mostly because of the work that the liver needs to do. But because we bypass the liver, we're in the blood so quickly, you get a much more direct cause and effect. Just like when you have a sip of wine, you know that in about 10 or 15 minutes you're going to feel that wine. So we're much more responsive to consumer behavior than the old-fashioned tech. And as I say, we've done a lot of studies all the way from test tube through animals to humans. And as I say, I think we might be the only company in Canada at this point in time that has completed a human clinical study with full PK pharmacokinetic data drawn and so on. So we're really at the forefront of that sort of work, and our technology over and again is demonstrating that it can stand right at the top of the world's best, shoulder to shoulder with anybody else. We always have new studies in the planning stages, so between now and the end of 2018, we are planning 2 or 3 more fairly robust and large sets of studies, and we'll report on those once they get started.
I like that you guys are actually doing a lot of those clinical tests, just because I find that in the cannabis sector primarily, it's one of those things that a lot of the data is, I don't want to say hearsay, but it's not as thoroughly researched or as thoroughly tested as you would find in most pharmaceutical areas. You know, we have people consuming cannabis so regularly, but without enough data maybe to show how it affects you, or maybe what amount of doses you would need even for medical purposes.
Oh, all of that is so true. GW Pharma, I mentioned them earlier, they recently had their Epidiolex approved by the Food and Drug Administration in the United States, which is a huge pat on the back. They deserve it. That was a heck of a project that they undertook some years ago when they started it. So in that particular set of work, now that was for cannabidiol, not for THC. THC, of course, as per your comment, you're bang on. It's easy to get a subjective binary response, yes or no. Do you feel the psychotropic effects of THC? You know, people can generally answer, yes, I feel high, or no, I don't. However, getting them to, in a quantitative matter, describe accurately what that high means is really, really difficult. And one other thing that a lot of people don't realize, and still kind of makes me smile a little bit, when a person smokes cannabis, it's THC delta 9 that is the active ingredient that is making a person high. When you eat cannabis and that THC is processed by the liver, the metabolite that exits the liver is not the same. It's been altered to THC delta 11 hydroxy. And that metabolite of THC is much more psychotropic than is THC delta 9. That's why the typical experience from an edible is quite different than the typical experience from smoking. But because our technology avoids at least first pass liver metabolism, some portion of the active ingredient of the delta 9 actually reaches the bloodstream without being metabolized. And thus, the effect of an edible that uses Lexaria's technology is more similar to that of smoking than any other edible that we have found. So there's a lot of subjectivity in this topic about asking people how they feel, or which edible you prefer. And it's a surprise and actually a little disheartening that there are a number of cannabis companies out there that don't even understand that basic chemistry of how things work when the cannabis is consumed and swallowed through the body. So it's a big topic. You're right. There's a lot more study that needs to be accomplished. And for THC in particular, I happen to think that both the subjective testing and objective kind of human clinical work is both important because of the difficulty in measuring numerically what a high means. It means different things to different people. So yeah, lots and lots of work still required.
Yeah, I find that really fascinating. Through your technology, you're avoiding that transfer over to, again, the more psychotropic effects of an edible, just because I find that as well with even prescribing edibles to people. For certain areas, they do sort of let the consumer know that this is going to be a different high and a different effect, almost closer to mushrooms than it is to cannabis.
Yeah, I mean, you're bang on, absolutely correct. I can't tell you how frustrating it is that in Canada, for medical cannabis patients, under the current law, the government insists that you get high in order to get healthy, where technology has already taken the next step and said, no, there's no need to get high if you want to medicate with cannabidiol and some of the other terpenes and terpenoids. All of that work can be done, but that type of distillation and extraction is all illegal under the current laws in Canada today. And I think that's something that needs to be changed. I think there needs to be a lot more understanding in our policymakers, just like so many other substances. The willow tree is a tree, and you can do all sorts of things with a willow tree, including get aspirin from it.
Yeah.
That doesn't mean you need the whole tree. Our policymakers need to understand that, and hopefully over the next year or two that will evolve.
So I want to go back just because you mentioned it earlier with your different patents and pending in over 40 countries. That's quite an impressive amount and a little bit unusual for a company as well of your size. Do you want to talk a little bit about your intellectual and property and licensing strategy?
Yeah, absolutely. As I've already mentioned some numbers, so we're patent heavy, and that number is increasing all the time. For example, the nicotine rat study that we did in the spring of 2018, we discovered we had that big uptake in delivery of nicotine into brain tissue. That was quite unexpected, and by its very nature formed the basis of a new patent application that we filed after that study was complete with that data in hand, because it turns out, for reasons we do not fully understand, our tech seems to also influence blood-brain barrier penetration. But our strategy from a larger kind of perspective has been a very, very simple one. Right from the beginning, we have said we're not trying to compete against other companies that are developing cannabinoid therapies. We're not trying to compete against GW. We're not trying to compete against Canopy. We're not trying to compete against these companies because whatever their area of focus might be, it might be treating a disease like epilepsy, or it might be treating a condition, or it might just be to have a better tasting edible. Whatever their focus is, we believe that Dehydratech from Lexaria can complement their drug or their process. So if GW has a drug on the market like they do with Epidiolex, and if it were to happen that our technology was shown to indeed improve the delivery speed and quantity delivered of the cannabidiol within the Epidiolex, well, we think that's a good match. So our strategy is one of ensuring that we can consistently do two things primarily and a third thing on the periphery. The two primary goals for us is we need to be able to be effective in delivery, i.e. we need to deliver more than the other guy, and we need to deliver it faster. Certainly if you're in pain, if you have a headache, you know, every minute matters, and you really want that headache to go away quickly. And then the third thing, because we're often dealing in consumer products rather than in drugs, is taste and aroma. Because if something tastes really bad, really funky, you're not likely to go back and use it too many times unless you really have to. And we think we've achieved that with our existing patent portfolio. I mentioned we already have 8 patents granted. They're backdated to 2014, so we have a pretty good patent suite, and it's growing all the time. We're awaiting patent approvals in places like India and China and Japan, the European Union, Canada. So as the patent portfolio strengthens, we don't offer that up with kind of folded arms as a barrier to people. We offer it up as a strength, as a way of saying, look, if you are working with us, we can help protect your products and your strategy behind our patent portfolios as well. So it's a core area of focus in the company. We have on our advisory board Dr. Ed Ergenzinger, who's a PhD in neuroscience. He's also our lead patent attorney out of North Carolina. We do have several patent attorneys who work for us. And so it's a big thrust of the company, and that will continue to be so for at least the foreseeable future of the next 2, 3, 4 years.
I know you guys are also forming 4 new wholly owned subsidiaries for pharmaceutical, nicotine, hemp, and then cannabis. Do you want to talk a little bit about that strategy and what that means maybe for the bigger picture for your company?
Sure. We certainly realize that, say, companies in the pharmaceutical industry or the nicotine industry, tobacco industry, even today often do not want to have any association with a cannabis company. So that was one of the reasons why we wanted to build a fence around our different intellectual property assets. And so the 4 subsidiaries you mentioned, hemp, cannabis, pharmaceutical, and nicotine, are in the process of being endowed with the appropriate intellectual property from the parent company, specific to each of their sectors. We think it's a good thing for our shareholders. I'm still the biggest shareholder of the company, by the way, so it affects me just as much or more than anybody. And we think it's a good deal for the shareholders because it gives us the opportunity to take those subsidiary companies into slightly different paths, allow for separate financings, separate possible spin-outs at one day, even future potential cash generation, and so on. We think it adds a lot of versatility to the company, minimizes shareholder dilution, and certainly will help us to be able to conduct business with a broader swath of Fortune 500 and corporate America, corporate global companies by separating and building those fences in between them.
On your website, you guys mentioned that the legal cannabinoid consumer product space is expected to show the compound annual growth rate of more than 25% through 2021. So do you see that number maybe increasing based on the federal legalization here in the fall? And also, do you think that that's going to have a push for legalization in the U.S.? Where do you see the industry going in the next sort of 10 years maybe?
I think the general answer to all of that would be kind of yes. I think that the growth rates for cannabinoid edibles, cannabinoid consumer products, that it would include capsules and so on, I think is going to be strongly double-digit for many years to come. I also think, and I actually wrote a paper on this recently talking about early adopters, and I made an analogy between, say, Elon Musk and Tesla customers and the cannabis industry. Because if you think about it, several years ago, there were thousands of people willing to write a check as a deposit for a Tesla car that had not yet been built. And they wanted an electric car no matter what. And of course, Elon Musk went out and built it, and he did a great job. The trap in that is that none of those people are representative of the bigger market for the Tesla car, because they're all early adopters. And whether the car was blue or red or pink, whether it was high or low or fat or skinny or whatever, they still would have bought it because they really wanted an electric car. But as a market, every market, this is just kind of economics, second-year economics, as an economy matures and a market matures, the consumer profile changes, and you move away from the early adopters and you move more towards the center of the market. You always do. And now consumer tastes, well, it's the wrong shade of red, or it's not quite as sleek as I would like. They become paramount. And if you cannot meet those needs, you fall by the wayside. Well, it's my theory that that process is going to happen in the cannabis market. And what has driven the market so far has been, of course, the early adopters. And God bless them, because they had the laws changed and they're getting people out of jail and all the rest of it. But they're probably not representative of, three of your neighbors at home across the street, the little old lady, the married couple who want to relax with cannabis once the kids are in bed on a Friday night. And they want probably a slightly different experience than those early adopters did. So I think as the market matures to embrace what I call the fat part of the demand curve, where most people lie, I think you're going to see huge growth, unimaginable growth in consumer-friendly methods of ingesting cannabis. That's not going to include smoking, because that's a battle that's over. That is not going to happen in the broad market. So I think cannabis edibles are going to be a huge area of growth. I do think that the federal legalization, both in Canada and even rumored a little bit in the United States, will be a huge plank of that. Obviously, you're going to need United Nations approval going forward, because there's a lot of treaties already that Canada is going to have trouble with because of its legalization federally. So you need more than one country to do this. So this is a long-term project. I don't think most people in Canada realize, this kind of makes me smile, that we're probably in the first or second inning. A lot of people think, hey, it's going to be legal in October, so we won, the game's over. I do not believe that true at all. I think that's the first inning. And now you're going to need the development of the edibles legislation, the international markets, the international acceptance of it, and then the societal acceptance of it. And that's going to take a long, long time. So, yeah, I wouldn't be surprised to see double-digit growth for a decade or more. And 10 years from now, 15 years from now, I wouldn't be surprised to see the cannabis industry bigger than beer or wine. I remember I'm older, but I remember watching the movie industry versus the computer gaming industry. And I remember when computer gaming was nothing, it was a piece of dust. And today, the computer gaming industry is twice the size of the movie industry. And who would have thought that was possible? But it happened. And I think you're going to see the same thing happen in cannabis products related to beer and wine. You may have seen Lexaria's news this week that we signed a definitive agreement with Hill Street Beverages, which just IPO'd on the Venture Exchange this week. And we've done formulation work with them. We're actually into our 5th generation of beverage formulation at Lexaria. We've been working on beverages for over a year. And I'm very, very, very proud to be able to say that we can make a cannabis beverage, whether it has THC or CBD is immaterial to us, that has no taste, no cannabis taste, and no cannabis flavor whatsoever, in a virtually perfectly clear, visually undetectable beverage. So yes, I think the beverage category is going to be a huge one, and the marriage of de-alcoholized beer and wine with cannabis is probably going to be a very, very popular sector.
Yeah, that would be, especially with like some of the research that's come out with the cannabis aid to removing addiction, and if you combine that with a non-alcoholic beverage, right, that's supposed to substitute that taste and flavor, that could be definitely a huge market.
Yeah, and I mean one of the fringe benefits of that is the concept that I don't know if you've thought of it, but when you remove alcohol from a say, a wine, you're removing the alcohol sugars, and the wine becomes almost sugar-free.
Yeah.
Which is to say it's almost calorie-free. So, there are some really interesting side benefits of reducing caloric intake with cannabis products if those cannabis products are made, I'm going to pat myself on the back, with Lexaria's technology or with some sort of enabling technology that allows you to reduce the amount of sugar. So there's some real good side benefits here.
Yeah, thank you so much. It's been a real pleasure talking to you, and I've been quite excited hearing about your technology because I do think that you guys are on the right path and definitely a cutting edge for that market and that sort of application.
Well, thanks very much. I really appreciate it, and it's always good to get out to a new audience and all of that. So happy that we're able to have done it, and happy to have met you.
Yeah, absolutely, man.
That's all for today's podcast. For disclosure purposes, Lexaria Biosciences Corporation is a paid client on Investor Ideas as a sponsor of the daily podcast. Please read our disclaimer and disclosure pages on the investorideas.com website for more details. Podcast is now a certified word trademark on the blockchain through Cognate Incorporated CN certification, and investorideas.com podcasts are also available on iTunes, Spotify, Google Play Music, Stitcher, iHeartRadio, Speaker, and TuneIn. If you would like to be a guest or sponsor of this podcast, please contact investorideas.com. Investor Ideas reminds all listeners to read our disclaimers and disclosures on the investorideas.com website, and this podcast is not an endorsement to buy products or services or securities. Investors are reminded all investments involve risk and possible loss of investment.